Cervical cancer is not especially common, but still affects thousands of women in the United States annually, with over 13,000 new cases expected to be diagnosed in 2025, along with over 4,300 deaths. Cannabinoids show promise as an option to reduce cervical cancer-related mortality. While the research is not as extensive as other cancer types, what does exist is encouraging. A 2010 study by German researchers showed that CBD could reduce invasion of both cervical cancer and lung cancer cell lines. The anti-invasive effects were mediated by the cannabinoid receptors CB1 and CB2, as well as another receptor called TRPV1. Since invasion and subsequent metastasis is usually the most dangerous element of cancer development, this property of CBD is quite important. Research also shows CBD can directly kill cervical cancer cells. A 2016 study by researchers with Northwest University in South Africa showed CBD induced a form of programmed cell death called apoptosis. This was also a rare instance where CBD alone was more effective than a whole plant extract, although overall research tends to suggest that in humans, whole extracts with the full range of cannabinoids and terpenes are more effective. In 2023, researchers with a different South African school, University of Johannesburg, showed that CBD could work together with a conventional treatment called photodynamic therapy to cause apoptosis in cervical cancer cells. After treating cells with both therapies, only 13% remained viable, with 7% in early apoptosis and 64% in a late stage of the process. In addition to cell death, researchers stated the combined treatment could limit cervical cancer spread. THC has also been shown to reduce invasion of cervical cancer, with a 2008 study finding that this cannabinoid, along with a stable version of the endocannabinoid anandamide, decreased cell invasion. As the previous study indicated, our own endocannabinoids appear to play a role in cervical cancer suppression. This is supported by a 2004 study from the University Hospital in Switzerland, where anandamide induced apoptosis in 3 different types of cervical cancer cells. In the graph here, the top line with square boxes are healthy cells, and the other 3 lines are cancer cells. The fact that anandamide is effective makes it at least a little more likely that plant-derived cannabinoids would work in humans. Evidence indeed suggests that cannabinoids can have anti-cancer effects in humans. A woman named Shona Lay had her story shared on the Australian news website The Courier Mail. She was diagnosed with stage 2 cervical cancer in October 2013 and decided to try apparently THC-rich cannabis extract as the only treatment. Shona monitored her progress every 6 weeks, and by September 2014 had clean test results. She then ceased cannabis use, but 4 months later, large lumps appeared in her breast. It's unclear whether this was cancer or not. However, Shona restarted using a cannabis-infused coconut oil, and within 2 weeks, the lumps were gone. More extensive research is needed for how cannabinoids can help cervical cancer patients. One day, cannabis may be recommended by physicians alongside conventional cancer treatments as a mainstream integrative option.